Boils, also known as furuncles, are a common skin infection. They are often painful and can cause significant discomfort. Understanding what boils are and how they form can help you manage and prevent them effectively. Boils start in hair follicles, which are small holes in your skin where hair grows. These follicles can become blocked or irritated, leading to the formation of a boil. Bacteria, particularly Staphylococcus aureus, get trapped in the follicle and cause an infection. This bacterial invasion is the primary trigger for the development of a boil. This infection leads to a red, painful bump filled with pus. The pus is a mixture of white blood cells, bacteria, and dead skin cells, which accumulates as your body fights the infection. Boils can happen anywhere on your body. They are not limited to one specific area and can appear wherever hair follicles are present. They are common in areas where sweat and friction occur, like your face, neck, armpits, buttocks, and groin. These areas are more prone to irritation and bacterial growth, making them hotspots for boils. Most boils are harmless and heal on their own within a week or two. During this time, it's important to keep the area clean and avoid squeezing or popping the boil, as this can spread the infection. However, some boils can grow large or become severe, requiring medical attention. If a boil does not heal or continues to grow, it may need to be drained by a healthcare professional. It's important to understand the causes, symptoms, and treatment options for boils to ensure proper care and prevent complications. Early intervention can prevent the spread of infection and reduce the risk of scarring. Knowing how to prevent boils can also save you from discomfort and potential scarring. Good hygiene practices, such as regular washing and avoiding sharing personal items, can reduce your risk of developing boils. So let's dive in and learn more about these pesky skin infections. By understanding boils better, you can take steps to manage and prevent them, ensuring healthier skin and greater comfort. A boil usually starts as a small, red bump. It might be tender to the touch. Over a few days, the boil will grow larger and become more painful. The area around the boil may also become red, swollen, and warm to the touch. As the boil fills with pus, a white or yellow tip may appear at the center. Some people may experience fever or feel generally unwell when they have a boil. The pain from a boil can make everyday activities uncomfortable, especially if the boil rubs against clothing or is in a sensitive area. If you notice any of these symptoms, it's crucial to avoid picking or squeezing the boil, as this can worsen the infection and increase the risk of scarring. Diagnosing a boil is usually straightforward. A doctor can usually tell if you have a boil simply by looking at it. They will ask about your symptoms and medical history. In some cases, the doctor may take a sample of the pus from the boil. This is called a culture. A culture can help identify the type of bacteria causing the infection. This information can help the doctor determine the most effective treatment. If you have recurring boils or the infection is severe, the doctor may order blood tests to rule out any underlying medical conditions. Section 4. Exploring treatment options. Treatment for a boil depends on the size and severity of the infection. For small boils, home care is often sufficient. Applying warm compresses to the boil several times a day can help bring the pus to the surface. Gently washing the area with antibacterial soap and water can also help prevent the infection from spreading. It's crucial to avoid picking or squeezing the boil. For larger boils or boils that don't improve with home care, medical treatment may be necessary. A doctor can drain the boil by making a small incision in it. This procedure is usually done in the doctor's office using local anesthesia. The doctor may also prescribe antibiotics to help clear the infection. Section 5. Home remedies for relief. While it's essential to consult a doctor for diagnosis and treatment, several home remedies can help alleviate the discomfort of boils. These remedies can be easily done at home with items you likely already have. They are simple yet effective and can provide significant relief. Applying a warm compress is one of the most effective ways to promote drainage and reduce pain. The heat from the compress increases blood flow to the area, which helps the boil come to a head and drain naturally. This can speed up the healing process and provide comfort. Soak a clean washcloth in warm water, wring out excess water, and apply it gently to the boil for 10 to 15 minutes, several times a day. This method is not only soothing but also helps to soften the skin, making it easier for the boil to drain. You can also try a warm compress with diluted Epsom salt. Epsom salt has natural antiseptic and anti-inflammatory properties, which can help reduce swelling and draw out the infection. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help manage pain and reduce inflammation. These medications can be particularly helpful if the boil is causing significant discomfort or if you have multiple boils. Remember to follow the recommended dosage instructions. Taking more than the recommended amount can lead to serious health issues, so it's important to adhere to the guidelines provided on the packaging or by your healthcare provider. Maintaining good hygiene is crucial in managing boils. Good hygiene practices can prevent the spread of infection and promote faster healing. Wash your hands frequently with soap and water, especially after touching the affected area. This simple step can prevent the infection from spreading to other parts of your body or to other people. Section 6. Preventing future boils. Preventing boils involves adopting healthy hygiene habits and taking steps to minimize the risk of bacterial infection. This means being mindful of your daily routines and making small but significant changes to your lifestyle. Wash your hands frequently with soap and water, especially before touching your face or any open wounds. Hand hygiene is one of the most effective ways to prevent the spread of bacteria that can cause boils. Shower or bathe regularly, using antibacterial soap, particularly after sweating heavily, or engaging in activities that cause friction on the skin. This helps to remove bacteria and reduce the chances of infection. Avoid sharing personal items that come into contact with your skin, such as towels, razors, and washcloths. Sharing these items can transfer bacteria from one person to another, increasing the risk of developing boils. If you have recurring boils, consider wearing loose-fitting clothing and breathable fabrics to reduce sweating and friction. Tight clothing can irritate the skin and create an environment where bacteria thrive. Additionally, it's essential to keep your skin clean and dry, especially in areas prone to sweating. Using antiperspirants can help manage excessive sweating, which can contribute to the formation of boils. If you have any underlying medical conditions that may increase your risk of boils, such as diabetes or a weakened immune system, work with your doctor to manage these conditions effectively. Regular checkups and following your doctor's advice can help you stay on top of your health and prevent complications. Keeping your environment clean is also crucial. Regularly disinfect surfaces and household items that come into contact with your skin. This reduces the presence of harmful bacteria in your surroundings. Lastly, maintaining a healthy lifestyle by eating a balanced diet, staying hydrated, and exercising regularly can boost your immune system. A strong immune system is better equipped to fight off infections, including those that cause boils. Section 7. Conclusion: taking control of your skin health. Boils are a common and often painful skin infection. Understanding the causes, symptoms, treatment options, and prevention strategies can help you manage this condition effectively. While home remedies can provide relief, it's crucial to seek medical attention if a boil is large, doesn't improve with home care, or if you experience severe symptoms. By adopting good hygiene practices, taking steps to prevent infection, and seeking prompt medical care when necessary, you can take control of your skin health and minimize the impact of boils on your life. Remember, a proactive approach is key to preventing and managing boils effectively.